Gastrointestinal system assessment. When assessing the gastrointestinal system in a home health setting, the approach should be holistic, patient-centered, and functional, with a strong focus on observation, patient interview, and safety within the home environment. Assessing the gastrointestinal system effectively is crucial for identifying GI issues, managing existing conditions, and promoting overall digestive health. Here's a clear breakdown of how to approach it. Collect information on the patient's GI history, including any previous surgeries, diagnoses such as gastroesophageal reflux disease, GERD, irritable bowel syndrome, IBS, diverticulitis, liver disease, etc., and relevant family history. Inquire about current GI symptoms such as abdominal pain, bloating, difficulty swallowing, nausea, vomiting, note frequency, triggers, appearance, and volume. Monitor for signs of gastrointestinal bleeding such as gastric pain, blood or coffee ground like vomit and/or black tarry stools. Assess the severity, frequency, and duration of symptoms. Assess mouth for any sores, bleeding gums, cavities, toothache, etc. Gather information about the patient's dietary habits, food intolerances, and any recent changes in appetite or weight. Assess the patient's ability to maintain proper nutrition and hydration. Review the patient's medications, particularly those related to the GI system, e.g. antacids, proton pump inhibitors, laxatives. Reinforce safe use of laxatives and how to recognize signs of a GI emergency. Monitor for potential side effects and ensure adherence to prescribed medications. Assess bowel habits, including frequency, consistency, and any signs of constipation or diarrhea. Assess bowel sounds in all 4 quadrants, right upper, right lower, left upper, and left lower quadrants. Note the following characteristics. Frequency, how often bowel sounds occur, e.g. 5 to 30 per minute. Quality, the type of sounds heard, e.g. gurgling, rumbling, high-pitched, rushing. Intensity, how loud the sounds are, e.g. quiet, moderate, loud. Location, where the sounds are heard, e.g. all quadrants, specific quadrant. Indicate whether sounds are normoactive, hyperactive, hypoactive, or absent. Inquire about the date of last bowel movement. Assess toileting ability. Is the patient continent? Can they access the bathroom safely? Is there need for grab bars, raised toilet seats, or commodes needed? Assess color, consistency, presence of blood, mucus, and stool. Conduct a thorough abdominal examination, including inspection, palpation, percussion, and auscultation. Evaluate for tenderness, distension, masses, firmness, scars, bruising, or other abnormalities. Monitor for signs of liver dysfunction, such as jaundice, dark urine, or changes in stool color. Inquire about any history of gallbladder issues and associated symptoms. Evaluate the patient's nutritional status and the presence of any nutritional deficiencies, appetite changes, decrease, increase, or loss of appetite, weight changes, any recent loss or gain, intentional or unintentional. Compare weight to baseline or previous visits. Dietary intake, meals per day, fluid intake, food tolerances, fiber intake. Evaluate compliance with any ordered diets such as low FODMAP diet. Assess the need for nutritional supplementation and notify MD. Assess diet prep ability and availability of resources to obtain food. Can they make or obtain appropriate meals? If no, evaluate need for referral to a social worker. Assess for presence of or missing dentures. Assess the patient's hydration status, poor skin turgor, dry mucous membranes, low urine output, especially if there is a risk of dehydration due to vomiting, diarrhea, or other medical factors and/or medications. Provide education on dietary modifications, fluid intake, and lifestyle changes to manage GI conditions. Offer guidance on recognizing and managing symptoms and when to seek medical attention. Ostomy care. Assess type of ostomy, e.g. colostomy, ileostomy, type of pouch, e.g. closed-ended, one-piece, two-piece, stoma and surrounding skin for signs of irritation or infection. New stoma site. Follow any specific guidelines and orders given, and as stated on the plan of care, a healed stoma may be cleansed with mild soap and water daily and as ordered on the plan of care. Inspect stoma for any changes in size or color. Inspect the skin for signs of irritation and report all undue changes promptly. Provide education on proper ostomy care and management. Instruct to eat a healthy, balanced diet, to eat slowly and chew well, to avoid the use of straws to reduce gas. Foods that may help to control odor and gas in some people are fresh parsley, yogurt, and buttermilk. Instruct to drink 8 to 10 glasses of water or liquids each day to limit the intake of caffeine and soda. Some foods that may cause gas and odor are broccoli, cabbage, cucumber, Brussels sprouts, cauliflower, beans, eggs, fish, cheese, onions, garlic, or alcohol. Instruct to avoid weightlifting, avoid tight, constrictive clothing, keep extra colostomy supplies on hand. Report to physician any change in size or color of stoma, persistent diarrhea or severe constipation, frank bleeding from stoma, purulent drainage or pain at stoma, and fever. Enteral feeding tubes. Assess type of feeding, amount, frequency, and mode of feeding, e.g. bolus, pump, type of tubing, e.g. G-button, peg tube, Mickey, etc. Orders for post-feeding and post-medication administration, flush, fluid amount. Determine if pills can be crushed. Is patient NPO or is allowed certain fluids and foods by mouth? Inspect stoma site for signs of infection. Look for redness, swelling, warmth, or drainage that is thick, yellow, or green. Check for skin breakdown. Assess the skin around the tube for any signs of irritation, breakdown, or excess skin growing around the tube. Tube placement and securement. Verify tube placement. Check the length of the tube visible outside the body and compare it to the documented length at the time of placement, admission. Ensure the tube is secure. Check that the external disc, bumper, is sitting flush with the abdomen and isn't moving up the tubing. Ensure proper fit and assess for any signs of skin irritation or excoriation. Check for migration. Monitor for any changes in the tube's position or markings on the tube daily. Patient tolerance of feedings. Assess the abdomen. Listen for bowel sounds and check for abdominal distension or tenderness. Monitor for feeding intolerance. Look for signs like vomiting, diarrhea, or difficulty passing gas. Check for residual. Before administering a feeding or medication, check for residual and document findings. Vent the tube to release excess gas from the stomach to relieve discomfort or reflux. Monitor weight and nutritional status. Regularly assess the patient's weight and overall nutritional status as ordered. Assess patient caregiver's ability to administer tube feedings, medications, and care for tubing, what to do if tubing is clogged or dislodged, use and care of pumps. Observe for return demonstration. Assess for aspiration risks, any abdominal distension, and signs of dehydration. Report all undue findings to MD. Communicate with other healthcare providers involved in the patient's care, such as PCP, gastroenterologist, dietitian, social worker, therapists, and nurses. Thanks for watching. For more videos like this, be sure to subscribe. If this video was helpful, hit the like button. It helps others find it too. If you're looking for helpful, downloadable digital resources on home health management, visit my Etsy shop. Link provided below. For questions and insights, drop a comment, and if you know someone who could benefit from this video, feel free to share. See you in the next one.